Hello, my name's Alane. I'm one of the students here at Mount Aloysius. I'm going to be testing your cranial nerves today, and I'm going to be testing for sensations, okay? The first thing that we're going to do is we're going to ask you a few questions. What brings you here today?
An exam.
An exam? Okay. Well, I have a couple questions for you. We're going to test your cranial nerves, and I'm just looking to see if you've had any dizziness recently.
No.
Headaches?
No.
Fainting?
No.
Let me see. Do you suffer from seizures?
No.
Tremors? Can you hold your hands out for me? Any involuntary movements? No. Okay. Okay. You're a well-groomed young lady. Can you tell me what today's date is?
It's January 20th.
Okay. And everything's symmetrical in the face. She's appropriately dressed. She's alert and oriented ×3, and her memories and orientation is intact. The first thing we're going to do is we're going to go ahead and test for the optic nerve or the olfactory nerve. So could you first just depress one of your nares, your right nares, and go ahead and blow a little bit of air out of your left nostril? And can you do the same on your left nares? Okay. So we're going to go ahead and cover one of your nares. And can you just tell me what scent you smell?
Vanilla.
Vanilla, perfect, okay. We're going to do the same thing now with the second nostril. And can you tell me what you smell in that nostril?
Cinnamon.
Okay, perfect. Okay. We're going to next test the cranial optic nerve. Can you just go ahead and read this line right here? We're testing that.
We buy pieces we are naturally drawn to, the ones that make you squiggle on the inside like a child.
Okay. We're going to go ahead and test to see if you have 20/20 vision because we're checking for the optic nerve. And I'm going to ask you to go ahead on the Snellen chart and read the line right across there that's in red.
DEFPOTEC.
Okay, that's 20/20 vision. Now we're going to use an Ishihara cards, and you're going to tell me what is in here. We're testing for color blindness.
So it's number 2.
Okay.
And 12.
Okay.
And that's 5.
5. Perfect. Okay. We're going to go ahead and look at the optic nerves, and we're going to go ahead and take a peek at that. Okay. Looking again. Good. Okay. I don't see any papilloma. The pallor's normal. No cup enlargement, and I see red reflex. I see the round depression. The crescent shaped is noted. The major vessels were noted in all 4 corners. The colors were within normal limits. There was no constriction on the vessels, and there was no crusting of the vessels, so everything looks good there. Now we're going to test for cranial nerves 3, 4, and 5. That is the oculomotor, the trochlear, and the abducens. And what I'm going to do is I'm going to test the cardinal field of gaze. So what I need you to do is just follow this without moving your head. And we're going to move this way. And then we're going to do the same again. Perfect. Okay, now we're going to go ahead. I'm looking to see if you have diplopia or what's called double vision. I'm going to go ahead and rapidly cover each eye, and you're going to tell me how many objects I'm holding up. How many objects am I holding up?
1.
Okay. Now we're going to go ahead and test what's called the star pattern. Okay. Okay, we're going to test the corneal light reflex. Okay, you're just going to look straight ahead. Okay. Now we're going to go ahead and we're going to test for the trigeminal nerve, cranial nerve 4. And I'm going to go ahead and start, oh wait, I'm sorry, I skipped one thing. We're going to check for the corneal reflex. It's these cotton wisps are going to lightly touch the white portion, your sclera of your eye. If it's intact, you will blink. Perfect. And we're going to do the same over here. Perfect. Okay. Go ahead and close your eyes. Now we're going to go ahead and we're going to test for number 4. Okay? And we're going to just lightly touch you, and you're going to tell me now when you feel me touching you.
Now. 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 Now.
Okay. We're going to test for sharp and dull sensations, okay?
Dull.
You're going to say dull or sharp.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay. Okay, we're going to go ahead and I need you to clench your teeth tightly together. And I need you to open and close. We're going to test your masseter muscles. Perfect. And we're going to try your your temporalis. I'm sorry, I can't say it. Okay, perfect. Those muscle strength is a nice 5. Okay, we're going to go ahead and test cranial nerve number 7. That's the facial nerve. I need you to first smile at me. Can you show me your teeth? Okay. Can you close both eyes tightly? And I'm going to try to open them. Perfect. That's intact. Continue to keep your eyes closed. And can you raise your eyebrows? Perfect. Can you frown? Can you puff out your cheeks? Okay. I'm going to lightly just try to depress the air there. Perfect. Can you tense your neck muscles? Okay. You can go ahead and open your eyes. Now we're going to go ahead and we're going to test to see your taste. Okay, so we're going to go ahead. I'm going to give you a glass of water here. That way, if it's bitter, you can rinse afterwards. And can you tell me what is on that?
Sugar. Sweet.
Okay. The next one is going to be
That's salty.
salty. Okay. And this last one.
Oh, that's lemon. That's sour.
Lemon. Okay, perfect. Okay, so the sense of taste is within normal limits. Okay, we're now going to test for number 8. This is the vestibular cochlear nerve. And I'm going to go ahead and perform the whisper test. I'm going to whisper in your ear and then I need you to repeat back to me.
9x1.
And I'm going to whisper into your right ear and you're going to whisper back to me.
The weather is hot today.
Okay. We're going to go ahead and do the rhyme test, and I'm going to be using a tuning fork to test to see how your hearing is, okay? I'm going to be touching you, and you're going to tell me when you hear the noise, when you no longer hear the noise, and when you hear the noise again.
I hear it. I don't hear it. I hear it again.
Okay, we're going to do the same over here with the rhyme test.
I hear it. I don't hear it. And I hear it.
Okay, we're going to perform the Weber test. And you're going to tell me if you hear this equally in both ears?
Yes.
I do? Okay. Or you do? Go ahead and stand up. We're going to go ahead and do the Romberg test. You're going to stand up. You're going to put your feet together, your hands at both sides. You're going to close your eyes, and we're going to see if you can stand straight for 20 seconds. I'm going to be here, so if you feel dizzy, I will catch you. Okay? Okay, you can open your eyes and you can have a seat. Okay, that was a normal Romberg test. Okay, we're going to go ahead and test cranial nerves 9 and 10. We're going to do the glossopharyngeal and the vagus nerve. I'm going to go ahead and have you stick out. I'm going to use a tongue depressor. I need you to go ahead and stick out your tongue and say ah. And I'm going to look. Go ahead, say ah. Do it again.
Ah.
Okay, great. I'm going to go ahead and look one more time inside your mouth, and we're going to test for a gag reflex. And we're going to do it on the other side. Perfect. I'm sorry. I know that's very uncomfortable. Okay, and now what I need you to do is just take a drink of water here. We're just looking to make sure that you don't have any signs of dysphagia. Perfect. Go ahead and open up. Perfect. Okay, we're going to go ahead and test cranial nerve 11. That's the accessory nerves. And what I need you to do is just shrug your shoulders. Okay, now I'm going to do that against pressure. Go ahead and do that again. Perfect. Now I need you, without raising your shoulder, I'm sorry, let's go ahead and turn our heads first. Can you turn your head to the left? Can you turn your head to the right? Now I'm going to go ahead. You're going to do it against resistance now. Left. Perfect. And right. Perfect. Okay, can you go ahead and put your ear to your left shoulder without raising your shoulder?